Unit 6. Individual Differences. Presentation 8. Psychological Therapies. Systematic Desensitization.
In this presentation, we'll be looking at a form of psychological therapy used in the treatment of abnormal behaviour, systematic desensitization. This form of treatment is developed from the behavioural approach to abnormal behaviour and is based on the principles of classical conditioning. It tends to be used in the treatment of anxiety, particularly anxiety associated with phobias. For example, animal phobias, fear of flying, or stage fright.
When people experience anxiety in a particular situation, they begin avoiding that situation as a way of making sure they don't experience those feelings again. The aim of systematic desensitization, therefore, is to reduce or even eliminate the anxiety that people associate with feared objects or situations, and which interferes with their ability to lead a normal, happy life. By substituting a new response to the feared situation, the contradictory response of relaxation, any previous phobic responses can be eradicated.
The nature of systematic desensitization. In systematic desensitization, this is achieved by gradually introducing the feared object, such as a spider, or situation, such as fear of flying, while maintaining a state of relaxation. In the early days of systematic desensitization, patients would confront their fears directly, learning to relax in the presence of objects or situations that would normally cause them significant anxiety, the in vivo approach. In more recent years, therapists have adopted an in vitro approach, where rather than requiring the patient to actually face the source of their fears, they are instead asked to imagine confronting the feared object.
Systematic desensitization in practice. Systematic desensitization begins by teaching the patient how to relax by using muscle relaxation techniques. This relaxation process is vital because anxiety and relaxation cannot occur together. Therefore, relaxation would inhibit any anxiety that might be felt in the presence of the feared object.
The next step is for the therapist and client together to construct a desensitization hierarchy. This is a series of imagined scenes, each one with the potential to cause a little more anxiety than the previous one. For example, for a person who has a fear of snakes, this hierarchy might begin by imagining a picture of a snake, eventually progressing to imagining seeing a real snake at the zoo, and then finally to imagining actually handling a snake.
The third step is for the patient to gradually work their way through their desensitization hierarchy, visualizing each scene, while at the same time engaging in their learned muscle relaxation technique. When they are able to maintain their relaxed state while imagining a particular scene, they are then encouraged by the therapist to move on to the next scene in the hierarchy.
By facing more fearful situations gradually, and by developing a pairing of relaxation with the feared object, then eventually relaxation rather than anxiety becomes the emotion associated with the previously feared situation.
Treatment ends when the patient has mastered the feared situation that caused them to seek help in the first place. When this is accomplished, the patient is described as being desensitized toward the previously feared object or situation, and they are then able to remain relaxed in its presence.
Evaluating systematic desensitization. A strength of behavioural therapies, such as systematic desensitization, is their appropriateness in the treatment of anxiety-related disorders. Compared to therapies such as psychoanalysis, where patients must play a more active role in their treatment, systematic desensitization requires less effort on the part of the patient. As a result, successful outcomes can be achieved relatively quickly. This form of treatment can also be self-administered by using computer simulations. This means that systematic desensitization is particularly appropriate for people suffering from a social phobia that makes it difficult for them to seek treatment outside of the home.
The acid test for any form of treatment is whether it actually works. In this case, whether it really does reduce the anxiety experienced by patients when faced with a feared situation. The signs are encouraging, as research has established the effectiveness of systematic desensitization for a range of anxiety disorders. For example, a Spanish study by Juan Capafons and colleagues demonstrated the effectiveness of systematic desensitization in overcoming fear of flying, properly called aerophobia. 20 clients were first taught to relax, and then worked their way through a hierarchy of steps relating to travelling by plane. These clients subsequently reported lower levels of fear compared to a control group of 21 aerophobics who had not received desensitization treatment and showed lower physiological signs of fear during a flight simulation.
Unfortunately, systematic desensitization is not without its limitations. For example, although systematic desensitization may appear to resolve a problem, simply suppressing symptoms may result in other symptoms appearing instead, a phenomenon known as symptom substitution. An example of symptom substitution would be the replacement of one phobia with another. Critics of behavioural therapies such as systematic desensitization argue that attempts to remove a symptom such as the anxiety associated with flying without addressing the underlying cause of the fear will merely result in the emergence of another, possibly unrelated symptom.
A final limitation of this form of treatment is that it does not appear to be effective in treating all forms of phobias. There is an important difference between phobias that were once adaptive for our ancestors and those that may have been acquired by modern humans as a result of their personal experiences. The former types of phobia, such as fear of the dark, fear of heights, or fear of dangerous animals, are much harder to treat using this technique than are the latter type, such as cyberphobia, the fear of computers. The reason for this difference is most probably that these ancient fears helped our ancestors to survive, therefore are harder to shift even among modern humans.
What can we conclude? Although the effectiveness of systematic desensitization as a treatment for anxiety disorders is well established, interest in the use of this technique has dropped dramatically in recent years. McGlynn and colleagues found that this decline in interest in systematic desensitization was due to the emergence of other therapies, such as cognitive behavior therapy. These competed directly with systematic desensitization in the treatment of psychopathology, and are now the preferred form of treatment.